The Choosing Wisely program is a program started by the American Board of Internal Medicine to begin a discussion to identify unnecessary, wasteful tests and procedures. The way they've gone about this is trying to identify 5 areas for improvement, to have discussion between patients and physicians. In 2013, the American Academy of Pediatrics first came out with the Choosing Wisely campaign, focusing on 5 things that patients and physicians should question. For the first time in 2018, it's focused on pediatric nephrology. One of the challenges of the Choosing Wisely campaign is coming up with the 5 clinical measures. It sounds easy, but it's really not that easy. Before we tell someone that we want to eliminate a test or not do a test, we want to make sure that no child suffers from that and that we're not tying physicians' hands behind their back. As medicine changes, as test changes, as practice changes, we need to scrutinize what we're doing and find areas that are wasteful where we think we can improve things. I think there's really 2 measures that are most impactful and are things that we really need to spread to the general pediatrician. One is the use of a urinalysis, and 2 is office blood pressure checks. These urinalysis are screening tests, and they're exquisitely sensitive, which means there's going to be a lot of false positives. Even in children who may be symptomatic and may have an acute illness, there's also going to be false positives, particularly for blood and protein in the urine. Many times there's transient blood in the urine and an acute illness, which will resolve if checked on repeated measures, and frequently protein appears on a urinalysis during the day, either because the urine is very concentrated or for something called orthostatic proteinuria or positional proteinuria. There's numerous reasons why a child who will come to the office will have falsely elevated blood pressures. So what we're telling pediatricians, before reacting to an elevated blood pressure, repeat the blood pressure manually, at rest, multiple times at each setting, and on repeating settings before pursuing further evaluation or referral. One big challenge of the Choosing Wisely campaign for pediatric nephrology is just getting the message out. This is a great measure that we've come out with, but now we have to educate the pediatricians about it, and we need to let pediatric nephrologists know about this measure so then they can spread the word and implement it in their hospital and in the general pediatric community.